Hello and welcome. This video is all about checkpoint inhibitor immunotherapy, which your health professional has decided is the best treatment for your cancer. Before you can start immunotherapy, you need to understand how the treatment works, the potential side effects it can cause, and what you need to do if you're affected by side effects. Your immune system guards your body by only allowing healthy cells to circulate and destroying anything else, like bacteria or viruses. But cancer can disguise itself so the immune system doesn't see it. Immunotherapy drugs boost your immune system, so your body's security sees through the disguise and fights off the cancer. You might have immunotherapy combined with other anti-cancer treatments or by itself. Your health professionals will keep you informed about your treatment and any updates that might be made. Immunotherapy is delivered through a drip in your arm or hand, or through an injection, usually at your local oncology centre, though you may receive treatment in one of our outreach treatment units or mobile units. Not everyone gets side effects from checkpoint inhibitor immunotherapy, but they can be serious, and some may last for a lifetime. Side effects occur when the boosted immune system begins to attack other healthy parts of the body. Anywhere can be affected, and you may have more than one side effect at a time. Side effects can develop weeks or even up to 18 months after your last dose, so checking often and being aware of any changes in your body is really important. Reporting any side effects to your team or the treatment helpline quickly will likely make them easier to treat and reduces the chances of treatment stopping. This list doesn't cover every possible side effect, but it does show you what you need to look out for. Head. Are you more confused or having memory problems? Do you have any headaches, seizures, or dizzy spells? Eyes. Any changes in your vision should be reported. It's worth getting your eyes checked before your treatment starts to make this easy to do. Lungs. Do you have a new cough or any shortness of breath? Skin. Keep an eye out for any new rashes, itches, blisters, or peelings. Please also report any new mouth ulcers or soreness. Nerves. Any sense of numbness, pins and needles, or loss of movement should be reported. Hormones. New headaches, profound weight loss or gain, dizziness or tiredness should be reported, as this could mean that the thyroid gland, adrenal or pituitary gland are not working properly. You should also let your team know if you're more hungry or thirsty than normal, or if you're peeing more often, as there is a risk you'll develop diabetes. Bowel. Keep an eye out for tummy pain or cramps, blood, mucus or diarrhea when you go to the toilet. Liver and kidneys. Your team will check with a blood test. Muscles and joints. Report any new pain. Occasionally, we may refer you to a specialist in a larger hospital, so you receive the most appropriate care in the most appropriate place. For example, if your lungs are being affected, we may consult a lung specialist, a heart specialist, or hormone specialist, depending on what you're experiencing. Your local hospital may have an acute oncology service, who is a link to provide information about your care and treatment to and from your oncology team. If you experience side effects, you may be referred to the immunotherapy side effects team, who will work with your treatment team to help you manage until you're well again. We'd recommend keeping a journal of how you feel to help you keep track of any changes or side effects, so you know when anything crops up. You should also check your skincare regime for any perfumes that might irritate your skin, and talk to your doctor about getting a flu and COVID vaccination. You might have heard about cannabis oil, but we'd recommend against using it, as CBD can dampen your immune system while we're trying to stimulate it. Don't be afraid of reporting side effects or symptoms to us. Immunotherapy drugs have a long half-life, which means they stay in the body for a long time, so they'll continue to work even if treatment has to be paused. Their long half-life is why you must carry your immunotherapy alert card all the time, including up to 18 months after you complete your treatment. So everyone knows your immune system may still be responding to the drugs and can treat you accordingly. Here are some frequently asked questions. Will I have an allergic reaction to immunotherapy? This is unlikely, but if you should feel unwell, for example with symptoms such as shortness of breath, back pain, wheeze or itching while the immunotherapy is being given to you, let the nursing staff know straight away and they will act accordingly. Will I have a super strong immune system? No, you won't have a super strong immune system. You don't have any extra immunity to viruses, etc., but you don't have a lowered immune system either. Will I lose my hair? This is very unlikely. The majority of patients receiving immunotherapy do not lose their hair. Some report hair thinning, but that's very few and far between. Can I have access to hospital transport? Yes, if hospital transport is required, please provide as much notice as possible. Should I change my diet? You should continue to eat a healthy, well-balanced meal with lots of variety. Should I avoid friends and family members who are unwell? Exercise common sense. If someone has an active infection, for example flu, COVID or cold-like symptoms, then it would be advisable to avoid or minimise contact.